The Mu variant of the coronavirus has now been confirmed in all 50 states. And as health experts try to figure out how it behaves, there is concern tonight it could compete with the already highly contagious Delta variant and overwhelm hospitals all over again. Our Liam Collins joins us now to break it all down for us. Liam, what have you learned?
Cindy, good evening, and we're still a long ways away from that, to be clear. The World Health Organization has classified Mu as a variant of interest, and they say that there's still much more data and information needed to move that around and to raise that classification, and there's still a lot more information needed as well to see if it will overwhelm our hospitals all over again.
We're always, at least for the foreseeable near future, going to have our guard up.
Record high hospitalizations in overwhelmed emergency rooms. The Delta variant continues to wreak havoc on healthcare workers, and now concern the new Mu variant could cause more damage. Erlanger doctor Jay Sizemore says it's too early to tell.
If it's not that transmissible and it doesn't outcompete the other variations, it may or may not be something that we ever have to clinically worry about.
The World Health Organization is classifying Mu as a variant of interest, a step below the variant of concern classification that Delta falls under. That means the variant is more contagious, creates more severe illnesses, and is more evasive to antibodies. There's still data needed to determine if that's true for the Mu variant.
Clinically, the management is the same.
But the new variants are still worth tracking, since CHI Memorial Dr. Carlos Balaero says there's preliminary evidence the current vaccines on market could be less effective against the variant.
We're so stretched and our resources are so stretched because of the numbers that it is important to track these variants.
The variant has been detected in just a few hundred cases across all 50 states, accounting for less than 1% of new COVID cases. But the fear it could cause another surge of COVID cases and severe levels of hospitalizations in the future is real for these frontline workers.
We don't have anywhere near the vaccine coverage that we need or we think that we might need to prevent that currently.
There's this fatigue of we're just going to keep doing the same thing over and over again.
Now, even if the Mu variant never rises to those levels of concern, both doctors say that current vaccination rates lead them to believe that a new variant could come up that does. And they say that the best way to prevent that from happening is those same things that people have been saying for months now. Get vaccinated, practice those public health measures, and put the worst of this pandemic to bed. Live in Chattanooga, Liam Collins, Channel 3 Eyewitness News.